Hey, my dear friends, you're welcome, dear listeners, and our friends around the world, in Nigeria and around the world. This is Vital Health International, a health conversation to help you eat healthy, live healthy, and feel healthy, and spend less money on doctors, on hospital fees, and on medical bills. It is my desire and our desire as we go on to help you live out your life on earth as God planned for you to live out. That's why this health conversation is coming your way. And I do hope that by the end of this program and in the subsequent weeks, you will learn a lot. Now, essentially, what TellMD will be doing, you'll be helping people make some of these early diagnoses, correct?
Yes.
Good.
Yes. So we are very big on what we call our wellness package.
Okay.
We advise you to do once a year. You get to meet with our physician who will talk to you. They want to know about your health,
Okay.
your past medical history, what has happened in the past.
Okay.
They want to know about your family medical history.
That's
Are
right.
there inheritances that you might be at risk of?
That's
They
true.
would look at your demographics. Are there things in the environment that might be contributing to
That's
your health,
correct.
your
That's
lifestyle?
correct. That's
They
good.
will look at your age, your sex, because there are some things that increase, or there are some risks that might be increased with the sex, with the age. So they'll look at all this and they would order some labs, tell you to do some screening tests. Then they'll come back with the results. They get the results, they analyze it, and you have a discussion.
Okay.
This is what you have to manage. This is what you have to do. Or this is this diagnosis. Or, oh, perfectly well, come back and see me next year.
Do you have to look at their politics? You know, which party they are, political party they are?
No, we don't do that. No, we don't do that.
Because some political parties can contribute to or
They can
aggravate some.
contribit. I have friends that stay up all night watching news channel because they want to see what's the latest. They want to know what's the latest.
Yeah.
That's stress. Stress
Yeah.
contributes to ill health. I
Yeah.
tell people, read your news. Don't watch your
Your
news.
news, okay. Read your news. No, I like that line. Read your news, don't watch your news, because when you watch your news, hey,
You can't control what you
you
hear.
can't control what you hear, but you need to be able to control your health and control yourself. Now, we're going to go into that because I like us to really explore the conversation on high blood pressure a lot, because high blood pressure is such a problem in the society. I had done quite some studies on high blood pressure within the Nigerian community. And before we talk about that, one of the things that have been reported by health professionals, the WHO and all that, has to do with non-communicable diseases, okay? And we have realized that about 70% of non-communicable diseases are actually the product of lifestyle modification.
Yes.
Good. So what has been your experience in that?
Yes, so it's our new Western lifestyle. Not just,
Okay.
I wouldn't just say Western.
Okay.
It's more, we are more mental these days than physical.
That's right.
In the past, our forefathers, they went hunting, they got their food and brought it back home. But now we sit at the table sedentary, and we transact, we do everything we have to do, 8 hours, and then we go home.
Yeah.
Our bodies were not built like that. We're not built to function like that. So in being sedentary, and then you are sitting there eating, and you are eating the quickest thing you can get because you can't afford to get off your chair to go and look for food.
That's right.
So you're probably not eating healthy. So all this is adding up. And this is what we call the evolution of lifestyle diseases. You're eating unhealthy. You're sitting sedentary for 8 to 10 hours a day.
Yep.
And even when you do get to work out, you might work out 2 hours and then you go veg out, you sit, and then you might give yourself rewards. So at the end
And in rewarding you cancel out whatever benefit you had by working out. Yes.
So at the end of the day, we see this evolution of lifestyle diseases. Some of them are like the hypertension.
Yeah.
Some are things like diabetes, hypolipidemia, or high cholesterol.
Yeah.
Yes. So these are things we are seeing in the society now. And then obesity. Let's not
Yes.
forget obesity.
Yes.
This is a big thing because obesity can cause all these things I've mentioned and more.
Yeah.
And it even puts you at risk for some cancers.
Yes, yes. Okay. So essentially, and this is, if you remember, this is something I talked about a lot in my program, lifestyle modifications. How you can take care of yourself, because at the end of the day, even when you see a physician, you see a doctor, you go to the hospital regularly, whatever is being prescribed for you, the medications they give you, if you're not compliant with your medication and you do not effect the necessary lifestyle modification, Nobody's going to help you with that in terms of sleeping well, in terms of eating well, in terms of being mobile, being active. You don't just leave home from an air-conditioned house, enter an air-conditioned car, drive into an air-conditioned office, sit on a comfortable chair, roll the chair from one part of the office to the other side of the other office, your food gets delivered to you, you eat in an air-conditioned office, and then you move back again into your air-conditioned car, back into your air-conditioned home, and go back to your air-conditioned bed, and things begin to happen in your body, and then you wonder why your body is falling apart. Lifestyle modification is huge. It's huge. Now, remember, you can reach Dr. Toyin on 0707 660-7330, 0707 660-7330. Okay, now what we're going to do right now, because I want us to, if we are going to be helpful to our people, if you're going to be helpful to your people, there are things that you need to we need to address some of these conditions, these health conditions, deliberately and specifically, right? The only thing that will not be done, what Dr. Toyin is not going to do, is to give you prescription over this platform, because it will be important for you to consult appropriately so that you can be given a proper diagnosis can be made, labs ordered if necessary, and then proper diagnosis is made and your treatment is initiated. Now, Dr. Toyin, you and I had talked off the air about conditions like hypertension, which is very, very common. Okay, and we realize that in Nigeria today, for instance, it's being predicted that in the next 10 to 15 years, in fact, in the next 5 to 10 years, the number of people who will be hypertensive in Nigeria will be close to 25 million, or 25 to 40 million, right? So now, what would you say? Number one, what do you say hypertension? What's hypertension?
So hypertension is when the blood pressure is measured and the results show it is greater than 130/90. So the 130 is the top number, the systolic, and the bottom number is the diastolic.
Okay.
So when the blood pressure is greater than that, and this is done more than once, and both times it shows that those numbers are high, yes, we say this is hypertension.
Okay. Now, when she talked about systolic, you talked about systolic blood pressure and diastolic blood pressure. The upper number is the systolic. The lower number is the diastolic. The upper number has to do with when your heart is contracting, right? So the pressure that your heart overcomes. Go ahead.
When I tend not to do technical too much, but when the heart squeezes our blood, that's the systolic. But when it relaxes to take in blood, that's the pressure of the diastolic. So that's the diastolic. So it's the squeezing and the relaxing
of the heart.
What the pressures are.
Okay. So now the normal numbers, I'd like you to write this down. The normal number she gave is that when your blood pressure is above, when the upper number is above 130, over being taken repeatedly over a period of time, most times they will say 2 times, 2 to 3 times, and the lower number is above, what did you say?
90.
Is above 90, and when that number is taken repeatedly, and so you are said to have hypertension. I know there are different stages of hypertension, but generally, what would you say is responsible for hypertension?
I would like to go back to one thing.
Go ahead,
My
please.
husband is a nephrologist.
Good. Nephrologist means that she's good.
He takes care of the kidneys and he knows a little bit about hypertension, or more about
hypertension. A little bit.
So it would like me to say, when you want to measure the blood pressure, you have to sit down and do it accurately. You have to have been sitting relaxed for at least 10 minutes.
That's right.
Be upright. Your arm should be at the level, almost at the level of your heart, and then your blood pressure machine here. I like to add that your blood pressure machine, you should make sure it's well calibrated, meaning that if someone has the pump one, you go to them, they check your blood pressure with the pump one, and they compare with the one you have, which is the digital one. And the difference shouldn't be more than 2. So that means if you get 130 on yours, the person should be at 128 to 132. They shouldn't go. And you should change your batteries every 3 months so that you can get accurate results. So best time to check your blood pressure, first thing in the morning, sitting at the edge of your bed, making sure your feet are flat, you're sitting upright, your arm is extended out, and you're checking it. And you can check it 2 to 3 times. You want to use the arm that has the highest blood pressure reading.
Which
and that
is
will be
the
your,
left hand.
That will be your checking arm all the time.
Okay.
So you check it with the arm all the time. And if you start, it's more than 130, then you repeat it. Then you repeat it after 5 minutes, 5 minutes. And then whatever you get, the average, you say, okay, this is my blood pressure for today.
And go ahead. And remember, you must have been sitting down. You must have been in resting position for about 10 minutes.
Yes.
Okay, because sometimes you're running around, you run up the stairs, you come up from the kitchen and you want to take your blood pressure, and the thing is a bit, it looks a bit high, and you need to calm down and rest for about 10 minutes. And even when you take it sometimes and the blood pressure is high, you need to calm down, rest for about 10 minutes, and then you repeat it again, repeat it, the blood pressure again, and you get the readings, and then you move on. Okay, so what would you say is, when you do that twice or 3 times and the blood pressure is high, what do you do next? Or how would you want to rate your blood pressure? Moderate?
We can do mild, moderate, severe.
Yeah.
So if you're still in the 130s, below 140s, we can say mild, stage 1. 140s to 150s. I'm talking about the top numbers now.
The top numbers, yeah.
Stage 2. Then 150s above, 160s above, we're looking at your stage 3s. This is what I'll give you as a classification. But usually this helps the doctors. It helps in knowing how can we manage this person's blood pressure. Is this a lifestyle thing? Can I still watch? Or at this point in time, should we start introducing medications? But also we look at other things, other comorbid factors. Does this person have a heart disease? Does this person have diabetes? Is there a need to make the blood pressure control tight? Or is this person older? Maybe for my older patients who are older than 75, and they tell me, oh, my blood pressure is 138 or 140 over 90. And I say, Mama,
not to worry,
don't worry, because they might get dizzy if you drop it too much.
Yes.
So it depends on, we look at the person holistically, if you would use that word, to be able to make recommendations on what to do for your blood pressure.
So essentially, it's possible for you to have what looks like a seeming elevated blood pressure, but you're much older, and because you're much older, that's not something to worry about. But again, that's why you do not make a decision on your own. You need to see a physician, and you need to see a physician regularly for them to make a proper evaluation of your condition. Now, assuming somebody does have high blood pressure, right?
Yes.
And some of the complications begin to set in. What are some of the things you begin to see are complications in high blood pressure?
Okay, we'll start from the head and go to the toes.
That would be good. It makes it easy for us to
It
remember.
makes it easy for us to remember. So we start from the head, we go to the brain. There could be strokes.
Yes.
It could present as, loss of function of some parts, maybe loss of sense of touch, or loss of motor, meaning you can't move. Or in the long run, it might be little strokes that one is not aware until one gets older. Then they say, oh, mama has dementia. And that will be vascular dementia from years of having high blood pressure. So stroke.
Okay, when you say vascular dementia, what does that mean?
Meaning blood vessel. It has to do with the vessels, vascular vessels.
Okay.
So it's a problem with the blood vessels. A lot of things can cause this, but hypertension is one of them.
Okay.
So we can go to the eyes. It can also cause retinopathy, right? And that
when
can
you say
lead to,
retinopathy, what do you mean?
meaning the retina, what helps the eyes see.
See, yeah.
Meaning that is disease. It has a problem.
Yeah.
So, and that can lead to blindness.
Blindness, yeah.
Okay. And we can skip and go all the way down. We can go to the heart. Yes. Several things can go on with the heart. We could have heart failure. We could have heart disease, coronary artery disease.
That's right.
We could have even aneurysms,
Yes.
meaning that the blood vessel itself will start tearing. Yeah, and blood starts leaking into the body of the blood vessel until it ruptures. So we could have a lot of things. We can go down to the intestines too. We can say there's ischemia, ischemic colitis. We can. So there's peripheral vascular disease, meaning blood vessel disease that happens in the periphery, meaning the arms, the legs, the blood vessels might be diseased, and that can happen in the bowels as well. We can go to the kidneys. It could cause chronic kidney disease.
That's correct.
That was what leads to people going on dialysis if it's not well managed. So I've gone from the head, I've gone to the toe.
To the kidneys, we go down to the toes.
Oh, we can stop at the penis too. It could lead to erectile dysfunction.
That's right.
I know men don't like to hear this, but it's
But that's the truth, yeah.
Yes. So we've gone to the penis, we've gone to the toes. I talked about peripheral vascular disease.
Yeah.
So I'll stop there.
Okay, that's good. Yeah. So you see that a disease as common as it is, because some people, they take pride in the fact that, well, I have high blood pressure. There was high blood pressure in my family. You know, when I say high blood pressure, it's the same thing as hypertension. There was hypertension in my family, so I'm not surprised that I have it. And my father lived up to 80 years of age, so it doesn't matter. But you do not know the age at which your father started having high blood pressure. And some people are much younger now, and they are having these symptoms or the signs of high blood pressure. But because they don't present with the symptoms immediately, they are not aware that their path in life is going to be saddled with a lot of problems. And that's why it's important for you to call Dr. Toyin. You want to call Tell MD 0707 660 7330 0706607330, so that a conversation with her and her team will allow for early diagnosis and proper treatment so that you can live long and live out your days on earth. I have always said this, that God put you in this earth for a reason. He doesn't want you to die prematurely. Hey, if you die prematurely, particularly if you know Christ, you are going to a good place. But what a waste that you did not fulfill your purpose here on earth, and your family members will miss you and loved ones will miss you. Now, you've talked about Dr. Tony, you've talked about some of these the side effects, the complications of hypertension, untreated, unmanaged hypertension. Now, what would you say? Is this something that can be managed? Can somebody have high blood pressure and still live a meaningful life? You know, with all the things you've rattled from head to toe, you know, erectile dysfunction that some men don't want to talk about. It might be because you have high blood pressure. No, can it be managed? Can somebody live a healthy life with all of that?
Yes, they can. So it depends. You have to talk to your doctor and then create a management plan, a treatment plan.
Yes.
First things first, lifestyle changes.
Yes.
That's always the first thing before medication. Some people like to just medicate everything away and not change their lifestyle. That's the easiest thing, but that's not always the best thing.
Yeah.
So lifestyle changes, it might include how do you eat, what do you eat, when do you eat.
Yeah.
It might include exercising, doing more. What do you do? Do you take a leisurely stroll, do retail therapy, like some of my friends? That might not be enough. You might need to do brisk walking. You might need to do some.
When you say retail therapy, what do you mean by retail therapy?
They like to shop. So they go window shopping.
They go window
and
shopping.
They say they've done their exercises.
Okay.
Yes. Some people find that calming and they think, okay, I've done this for 1 hour is enough. It adds up. But we usually would encourage brisk walking, brisk exercises, something that will raise your heart rate and sustain it raised for a little bit, at least 30 minutes or 150 minutes a week.
In a week, okay.
In a week, yes.
Okay.
Yes.
We're going to go back to that walking, because that's one of the questions I get asked all the time when I speak to people. Recently, I was talking to some men, and they were asking me, I don't like to exercise. That's what some of them were saying. I'm too busy. I don't have time to exercise. Now, remember, we're talking about lifestyle modification, because getting medicated for some of these conditions is good. But there are some things you can control by your lifestyle. Now, when you talk about just walking, I know the Surgeon General says, and WHO regulations and stipulations says 30 minutes a day, 5 days a week, 150 minutes of exercise in a week. Okay,
yes.
So or 275 hours in a week. So I want you to give it to me in practical terms. I work in the office, let's say as a banker, and I have to get to the office very early. So what does that brisk walking mean for me?
Okay. So currently my own lifestyle is not the greatest.
Okay.
I wake up very early. I wake up early to join a prayer group. So I realized that I can do two things. I can speak in tongues and I can walk on the treadmill.
Okay.
That works for me.
Okay.
So I can do that for 30 minutes, and 30 minutes I can do other things. I can get ready for my day.
Okay.
That adds up. I
Okay.
can do this 5 days a week.
Okay.
And at the end of the day, I can decide, oh, it's been a stressful day, I will do yoga. You can do yoga as well. I love yoga because it's stretching, it's toning, and it's exercise.
What's yoga?
Yoga is a form of exercise.
Okay.
You've not heard of yoga?
I've heard of yoga, but when I hear yoga, I think of Eastern mysticism.
No. no. Yoga is great. It is great. So it helps. It helps with muscle tone.
Muscle
it
tone,
helps
yes.
with firming up your muscles.
Uh-huh.
It helps with balance a lot.
Okay.
A lot of balance. As we grow older, balance is one of the things we have
Yeah,
to care and
I've
think
seen
about.
myself sometimes when I walk, I
Yes.
tend to want to,
Yes.
miss
And
my balance.
Yes, and then things like joint diseases.
Yes.
Yoga helps with building muscles, especially even in osteoporosis.
How? Because I used to think of yoga like incantation, like
No,
incantation. You just sit down, chuku, chuku, chuku,
No,
chuku,
there are
chuku, chuku, chuku.
different types of yoga. Maybe you're
Okay.
talking about the meditative one, but there's
Okay.
the power yoga where you actually sweat and sweat a lot.
So what do you do in those power yogas?
Something as simple as doing like maybe there are different poses.
Okay.
They have different names. Sustaining a position for duration, controlling your breath while the position is sustained.
Whoa.
So you're intentional about the position you're holding. And at times the positions are things that will challenge your muscles. Like if you had to do the warrior 1, 2, 3. So those different
But
positions.
you're not chanting
No,
incantation.
you're not chanting. You're just staying there doing your thing and holding
I
your
used to
muscles
think that
against-
yoga was
Yeah.
chanting incantation.
No. Yoga is great. I usually recommend it for a lot
you
of my
kidding me?
patients. Yeah. So
Wow,
you
I
can
think
see the
I
power.
think you've gotten me convinced now.
Yeah.
At least I know you. So if you are doing yoga and
I love the slow flow yoga in the evenings because though you're sustaining the muscles in you're doing isometric contraction and you're being mindful, it's helping you relax. So you're exercising but then relaxing. So you take a shower and go to bed.
Wow, and
Yes.
it can manage your blood pressure with that, right?
Yes, because you're
Okay.
doing intentional exercise.
Exercises,
You're
okay.
distressing.
Okay.
Because you're in the frame of mind, you're controlling your breathing. So everything you've done during the day that makes you speed up, makes your heart, you're controlling, you're being aware of
Yeah.
yourself, and yet you're still doing your exercises.
Wow.
So it's
Now,
great.
It's interesting.
It is great.
I mean, for me, because I've always heard of yoga as part of treatment for high blood pressure, but I have always been reluctant to contemplate yoga because in my head, when I think of yoga, I think of Eastern mysticism.
I'm not supposed to advertise for companies, but you
Yes.
can look online, and there are some online companies that do
you-
yoga.
Oh,
I
okay.
love them.
Oh, okay. I'll give it a shot. I'll give it a shot. And I can train myself in yoga, right?
Yes, they're online. You start from the basic classes.
Yeah.
I've never gone to a yoga class. I do my yoga in my house.
Okay, that's interesting.
Yes,
That's interesting.
I do my yoga in my basement
So-
and I enjoy it.
Okay, that's very interesting. Now, so we are talking about lifestyle modification for managing something like high blood pressure, which is a common condition. The figures I gave you was wrong. This was a study that was carried out about 5 years ago. It was said that in 20 years, Nigerians will be about 40 million
Oh, wow.
hypertensives.
That's more
That
than
in-
25.
Yep, I gave you 25 million, right?
Yeah.
That in 20 years, Nigerians will be about, so essentially in about 25 years, in 15 years, 10, 15 years, there will be about 40 million. And if you consider the numbers and all the changes that have taken place, all the political crises and the local and international, the Naira devaluation and all that, there will be way close to 50 million, 50 million hypertensives across
So
the
the
country.
political parties are increasing the risk of hypertension.
Oh yeah, they are. Yeah, I mean, if you're in one party and you lose an election, and you have to cross over to another party.
Okay. Okay.
So, EFCC is coming after you, and you have to. So that's a kind of condition for you. Now, so you're talking about yoga. So essentially, what's yoga? Yoga is simply being meditative to de-stress, to help you decompress some of the pressure that are built up in your personality. Okay, so that is very helpful. So now you go on your walk.
Yes.
You go on your brisk walk.
Yes.
Right now. 10 to 30 minutes, like I said, standard walking a week.
Sweat breaking.
Sweat breaking. Not the one that you're just walking, you're chewing gum and you're on your cell phone, you're doing selfie.
No.
That was going to help your blood pressure, okay? But you're walking briskly and you break sweat, some sweat run down your face, and you do that for about 30 minutes. You can even walk in your office. If you have stairs in your office, right? So you can go up and down the stairs, correct?
Yes.
So being a banker is not an excuse for me to live in ill health. So
and some people will say, oh, it's not safe in my area. What I would typically tell my patients is, do you have a dining table?
Good.
Do you have something you can walk around?
Around.
Please walk around
Yes.
it. Please walk around it.
Yeah.
That's all I say.
You won't believe it. I have a friend. I have this friend in Abuja, and I used to make fun of him. His waistline was a bit quite on the high side, and this guy used to run 10,000 steps in his living room. I remember visiting him, and I wake up in the morning and I see him. He's running around in his living room, 10,000 steps a day. And after doing it for a couple of months, you won't believe it. I mean, there was significant changes in his body.
Yeah.
So there are many ways to do your brisk walking. If you can buy a treadmill in your house, or if your office has one that allows you to walk. This is important, my dear friend, because like Dr. Twain said at the beginning of this program, much earlier, many years back, our parents, our family members, they walked a lot. They either went to farm, they didn't have cars, or they had bicycles. They walked a lot, so they were active. So that, if you look at the study, even the studies that have been taking place, in fact, there was a study that was taken that was done in Ghana in particular, and they realized that many of the civil servants who went back home, who left the city and went back home, they had lower blood pressures than the ones who remained in the city. Why so? Because when they went back to the suburb, they went back to the village, they became active. They were working in the farms, they were walking around, and they stopped driving cars and just staying in an environment where they were sedentary. Their blood pressures were controlled, and the blood pressures were lowered. So it's important for you to work. Don't take that as a doctor just giving you bad advice. This is good advice. Now,